Larry was told he was going to need a knee replacement, but when he got a second opinion, Dr. Michael SWARTZON said, hold on a minute, let's try something else first. Here's what he did. I know that you have a unique story to share with us, and for you it started with knee pain. Is that true?
Severe knee pain.
Severe knee pain, okay.
And I had a scheduled knee replacement. I was told that it was bone on bone, and I wanted a second opinion. Baptist Health was highly recommended, and I contacted Miami Orthopedics, and I was fortunate enough that they scheduled an appointment with Dr. SWARTZON, who, when we walked in, said, "You're not ready. I think we have an alternative."
What was your reaction to that after being told that you have to have surgery?
Well, the reaction is, I'm ready to listen. Tell me what else, what else I could do or could be done.
Tell me about the pain, because as you mentioned, it was bone on bone, very severe for you. Did it affect your daily activities? How would you describe it?
So we live in Miami Beach, and it's a great town to walk around in. And what was happening was I was driving more and more, walking less and less, and just wasn't happy. But that was the alternative because the pain was that bad. So
once you and Dr. SWARTZON got together, what was the initial consult like, Dr. SWARTZON? As you mentioned, here we have Larry coming in, being told that, hey, you're going to have surgery, and you're saying, wait a second, we can try something else altogether.
One of the first steps is we usually get weight-bearing x-rays of the knee, right? So people will come in with an MRI, which can be very descriptive as to the cartilage damage. But because you're laying down when you're getting it, doesn't always mean you can see what the function is.
Right.
So when we get weight-bearing x-rays, we can see, are you bone on bone? Like, how much space is there? And in Larry's case, there was some space. And so he wasn't, in fact, at that level of severe arthritis. He had moderate arthritis, which doesn't require a knee replacement at the level of pain that he was in.
Right.
Right? He's saying that he can't walk as much and he's not as active as he wants to be, which is not the same as someone with severe arthritis
who says, I can't do anything.
I can't do anything. I can't wake up in the middle of the night and go to the bathroom because my knee's in so much pain.
Right.
Right? Those patients are prime candidates for a knee replacement, whereas Larry had other room to grow.
So what made Larry a candidate for the PRP therapy?
So I look for someone who has a problem. Right, so if you came in and for some reason we saw arthritis in your knee and it wasn't bothering you, we wouldn't offer anything. But Larry came in saying, I was told that knee replacement's what I should do you agree? And I said, well, it's something you can consider, but here's something else you could consider that may be of better benefit with less risk that'll allow you to return to what you're asking to do, which is walking. Which
that sounds like a quite nice deal.
it's a very reasonable, he has very reasonable requests.
Right.
Right, he's not asking to return to running marathons. He's asking, or basketball. He's asking for normal activities of daily living.
And Larry, when you heard the term PRP and stem cell therapy, had you heard a little bit about it already before, or was this the first time really getting descriptive about it?
It was a new concept for me. And but I'm active, I'm employed, and it seemed like a great alternative to knee replacement.
Absolutely. And Dr. SWARTZON, do you often see that with patients, that they're almost in shock when they have these alternative treatments or procedures?
No, either complete shock or some skepticism, which I share. Right, with any new treatment option. And then optimism and wonder, like, what could this really work for me?
Right.
And so they get very curious, and it actually becomes a pretty long office visit, actually, discussing all this.
Okay, so I want to hear how the procedure went for you. So I believe you had 3, correct? You had the PRP first, then PRP with stem cell, and then PRP again.
With stem cell.
With stem cell, okay. So can we talk about the procedure and what was it like for you?
Well, first you have to talk about Dr. SWARTZON and his team.
Go ahead.
His team was fabulous. I mean, the care, the concern, just beyond anything I have ever experienced.
That's a great Yelp review right there.
Right.
Right? 4 or 5 stars. Good. Go ahead.
So it was actually fascinating. The amount of detail, even with the shots, it was an ultrasound machine to pinpoint exactly where it's going to be the best results.
Right.
And it's worked out fabulous for me. It's been a life changer.
So Larry, you're back to walking around Miami Beach, I hope.
I'm back to walking around Miami Beach. A week ago, we're in Disney World.
Okay.
And if you've been to Disney World, you know.
That's when you know the surgery, this procedure, I'm sorry, has worked.
And if my Apple phone was correct, I walked 10 miles one day, 12 miles another.
Wow.
And then this past July, we took a trip to Italy, and just no pain.
That's incredible.
And it's unbelievable.
Now, let me ask you, when did you first start noticing that there was a change, that there was more ease when it came to walking or your knee pain in general?
It's a gradual process, and after the follow-up, which was about 3-4 weeks later, the discussion was maybe we should add stem cell. That's another possibility.
Okay.
And was excited about the process because it was just slowly getting better. And after the first shot, or the second or the third shot that I had, each time it was a couple days in bed, keep the weight off the leg, and that was it.
That's incredible. Now, Doctor, one of the things that you had suggested, and Larry, you took him on that offer, is doing the physical therapy.
Well, physical therapy was really part of the deal.
Right, you have to.
You have to. And so I'm sitting behind a desk in employment, work, and you realize that your muscle is just not as strong as when you were 20 years old.
Right.
And so I always went to the gym, but never on the muscle side, never building muscle. It was more cardiovascular.
Right.
And realized that when I started the physical therapy, that really my legs have weakened considerably from remembering back to 20 and 30-year-old days. And so went through physical therapy for 3 months, 3 times a day. I would ride bikes on days when I wasn't in physical
therapy. Every day? 3 times a day every day, or 3 times a week?
3 times a week.
Okay.
And it's been I'm great.
Want to know more about other treatments for arthritis? Head to our website, allhealthtv.com, where we have lots of clips from different orthopedic insiders. You won't want to miss it. And if you have a question, call us 855-796-4475.